Hello everyone, my name is Collin and I'll be sharing a video presentation of our abstract on the expert validation of AI-generated patient information videos. There's been much excitement and discussion over the use of artificial intelligence or AI in healthcare, especially with the rise of AI-powered chatbots. AI has been touted to have the potential to transform the medical field. There is, however, a gap in research into the application of AI on enhancing intangible aspects of patient care, such as patient education. Studies have shown that suboptimal surgical counseling implicates patient care. Unpreparedness for hospital stay post-operatively increases anxiety levels. Preoperative counseling resulted in decreased anxiety and decreased physiotherapist and occupational therapist requirements. With the increasing potential of AI in healthcare, we sought to explore and utilize its potential within the context of preoperative surgical counseling in urology. However, there are doubts about its unvetted reliability and accuracy of information it disseminates. Our team of fourth-year medical students aim to assess the validity of PIVs generated entirely by AI, specifically on the topic of partial nephrectomy. The PIV was produced by medical students at the National University of Singapore with sequential use of multiple commercially available AI software. The preoperative counseling script was generated by ChatGPT, which is an AI-powered language model developed by OpenAI. A prompt was given to outline the scope of discussion in the video, which was to encompass the detailed coverage of all aspects of pre-surgical counseling. This was the output from the prompt given in the previous slide. Within seconds, ChatGPT has produced a comprehensive script for the purposes of pre-surgical counseling. A virtual avatar was synthesized using the commercial image generation software Midjourney. Subsequently, the script generated by ChatGPT was converted in its entirety without editing into an MP3 audio file using 11 labs. The integration of the virtual avatar with the audio file was achieved through the application DID. This application uses AI to create and match mouth movements with a given audio file and avatar. A 3-minute entirely AI-generated patient information video was created within 19 minutes. No costs were incurred as the AI software used were commercially available for free. The AI-generated PIV was presented to a group of 15 urologists from the National University Hospital in Singapore, each with more than 10 years of experience in partial nephrectomy surgery. We assessed the participants' impressions of the PIV using the Discern questionnaire, which consists of 3 sections to objectively evaluate the information presented in a publication. The publication is then given a final score, grading the quality from very poor to excellent. We consider the validation of the AI-generated PIV by specialists to be crucial to assessing the accuracy of information before its eventual exposure to patients. I will now show a snippet of the AI-generated PIV. The PIV has been edited for brevity, but the full 3-minute clip was shown to the doctors as part of the validation.
Hello, let's talk about your treatment options for your kidney condition. One option that we can consider is partial nephrectomy. Partial nephrectomy is a surgical procedure that involves removing a portion of the kidney that contains a tumor while preserving the healthy part of the kidney. There are different approaches to partial nephrectomy, including open surgery, laparoscopic surgery, and robotic surgery. Open surgery involves making a large incision in the abdomen to access the kidney. Laparoscopic surgery, on the other hand, uses several small incisions and specialized instruments to remove the tumor. Robotic surgery is similar to laparoscopic surgery, but uses a robotic system to assist the surgeon in performing the procedure. Studies have shown that all 3 approaches are equally effective in terms of cancer control and long-term outcomes. Ultimately, the decision will come down to what you and your doctor think is the best option for your specific situation. As with any surgical procedure, there are risks involved. General risks of nephrectomy, removal of the kidney, include bleeding, infection, and damage to surrounding organs. Approach-specific risks include the possibility of converting to open surgery if complications arise during laparoscopic or robotic surgery. Recovery time can also vary, but you will likely need to avoid strenuous activities for several weeks, and follow specific wound care instructions to ensure proper healing. There are alternatives to partial nephrectomy, including active surveillance, monitoring the tumor without treatment, and radical nephrectomy, removal of the entire kidney. However, not having surgery may have implications for your health, as untreated kidney cancer can spread to other parts of the body. I hope this information helps you in making an informed decision about your treatment options. If you have any questions or concerns, please do not hesitate to ask me or your healthcare team.
As mentioned, the video has been edited for brevity. Nonetheless, the video encompasses the various important aspects of pre-surgical counseling, including approaches, alternatives, risks and benefits, as well as inviting questions and clarifications at the end. This is an overview of the Discern questionnaire that was used. Discern is divided broadly into 3 sections. Section 1 scores the reliability of the publication. Section 2 scores the quality of information on treatment choice. And the last section is the reader's overall rating of the publication. This slide shows the breakdown of Discern scores by each section. The mean score for Section 1 by the urologist is 27.7, and the mean score for Section 2 is 25.5. This is about 69% and 73% of the maximum score attainable respectively. The mean total score is 53.13, which is 70.8% of the maximum score. Looking at the total scores, 40% of the urologists has placed the PIV in the excellent category, and 33.3% of the urologists had placed the PIV in the good category. Overall, the majority of urologists concur regarding the utility of the PIV. Now, in conclusion, this initial pilot study validated the information completely generated by AI for the use or production of PIVs. Yet, the majority of our expert panel urologists are in approval of its further use case. AI-generated PIVs may be produced in an efficient manner, with zero to no costs and low physical manpower requirements. This process demonstrates a significant potential for scaling. The process can be repeated for different types of urological surgeries with very little resources. Although the information was assessed to be accurate, further refinements could be made for the video to be more engaging and interactive. As a pilot study, we consider this an important vetting step to assess the feasibility of AI-generated PIVs before its eventual utility in actual clinical care. Thank you.